Hi. A lot of our patients have been asking us, what is TRYBE? And so what we wanted to do is introduce ourselves to you. I'm here with my good friends, Dr. Alejandro Mora, Dr. Andres Fernandez, and myself, Dr. Arturo Lizano. And we want to talk a little bit about how this amazing idea came to be.
At the end, we're trying to give the patient a better way to live. That's it, right? Removing the factors, of course, and the best way is with education.
That we can firmly help people get to their fullest potential, right? They can truly have optimal health.
There's not a cooking recipe for every patient, and that means that not all patients will receive the exact same treatment. Andres and I have been together in our dental office for almost 20 years now. We started as traditional dentists. He's an oral maxillofacial surgeon and I'm a prosthodontist. We have seen patients from all over the US and the world. There came a point that what we were doing was we weren't very excited about what we were doing. We thought there was something missing. Out of coincidence, we were invited for a dental trip to Switzerland, which opened our eyes. We were introduced to this world of biological dentistry, which we'd never heard of it before. And then we're gonna talk about how that integrates with you. But for us, it was a career change altogether, understanding what we could do to our patients, that we could actually save lives to dentistry. That was just mind-blowing for us. And we've been doing that for almost 10 years now. And that path took us to meeting a lot of people, understanding a lot of the needs and the problems that a lot of our patients were having. And even though we were starting to understand that most of the root causes of the problems started in the mouth, that was not it, that was not all, right? There were still things that were missing that we didn't really understand how to help them. And then we were introduced to a world of functional medicine, which we didn't even know it existed as well. And through coincidence again, we met again with our good friend Arturo, which didn't even know he was functional medicine doctor. One thing led to another, and now we're here merging all these two segments of medicine that are not really mainstream, that a lot of people don't really understand what they are. Dr. Andres will introduce you a little bit of what we do in our biological dental world.
As Alejandro said, we started as a traditional dentist. At that time, we work with all this mainstream material like titanium, removal teeth that were bad, but at the end we used to remove a lot of bone as well. Then when we went to Switzerland, they opened our eyes, and then we realized that we'll be able to do the things right, but with less invasive treatments and understanding a little bit of the biology of the patient. Then at that time, I remember Dr. Kleinhardt, that is a functional medicine functional doctor in the US and in Switzerland. He was part of this concept in Switzerland. We realized that part of the problems of the patient could be cured if we prep the patients with the functional medicine, and then we'll be able to remove the factors that were causing like a switching in the immune system. So pretty much in biological dentistry, we remove all the factors that are affecting the body. And of course, if we work together with Dr. Lizano, then we can merge the whole concept. So we remove the factors, and Dr. Lizano will be able to remove the other factors and coordinate all these levels of hormones. And of course, you can explain a little bit more what you do.
Sure.
And then we can prep the patients, we can remove the factors, and then Dr. Lizano will be able to continue with all the patient optimization.
I just want to say something. To me, this is really mind-boggling, and it's very interesting because I feel what happened to you guys happened to me. And we weren't really looking for it, right?
Yeah.
It was just like,
It happened.
it just kind of fell on our laps, you know? I know in my case, I was never looking for functional medicine. I wasn't looking for regenerative medicine. And when I heard your story, it was like, wow, this is really cool, because without knowing it kind of
We're doing the same thing in parallel path.
Exactly, parallel without knowing it. And that's how I came to be, that's how I fell into the functional medicine world. I studied medicine here in Costa Rica, and conventional allopathic, call it traditional medicine. Many years on, I traveled to the States to continue on my journey of conventional medicine, and I started hearing about regenerative medicine And this new era, this is 15 years ago. I mean, this was like, remember?
It's a long time.
It was unheard of. No one was talking about it. It was
There was no biohacking or
it was like
anything
science
that.
fiction.
Yeah.
¿Verdad? It was like science fiction. It was like, all right, it's someday, And to eventually, and interestingly, the same thing happened to you that happened to me. You said it really well. It was just mind-blowing, right? It just, at some point, as we say in English, we had these aha moments where we're like, maybe we aren't doing it the right way. It seems that we can do it a different way, and we started feeling that this different way was actually better.
It makes sense.
And it made so much more sense, right?
And you know what's like the shifting concept here is that we actually cure patients. You see the result. You see patients that have been working and trying to be pregnant, for example, for a while.
Yeah.
And after your treatments and the change of their life and the whole optimization, they got pregnant. Pretty much the same we're seeing in our patients. Yeah, is a palpable.
Yeah, and that's a mind blow.
Result. Yes.
So what we're doing here at TRYBE, it's merging these different areas into a single concept, which is biological dentistry, functional medicine, and regenerative medicine, which is human optimization at a different level. So through biology, through science-based evidence, we are creating protocols which will allow our patients from the dental side, from the functional medicine side, and also from human optimization resources.
Yeah, lifestyle intervention.
Yes, to get not only for those who are sick to become healthy, but for those who are healthy to stay healthy.
Exactly.
Right?
Exactly.
To
Feel better as well.
To feel better, to be to be able to
Have
play
healthy
with your
lives.
kids more, to go out more, to do sports that you like, to sleep better, to reduce your stress levels, to eat better. So it's just basically an entire full circle. We're not offering dental on one side and perhaps a little bit of supplementation on the other side and all that. We're trying to cover every single piece of the patient to get it from their journey from A to C in the healthiest way possible, and trying to actually achieve the results that the patients are expecting, and hopefully in a healthy and simplistic way, because this doesn't need to be over complex. Most things are actually
And it has become very
cost.
overly complex. We also believe, and we've spoken many times, how it has overwhelmed everyone. Sometimes even us, when we go and study new things, it becomes overwhelming. And at the end of the day, if we go back to, and that's kind of like the philosophy behind all of this, if we go back to the root cause, right? If we go back to the simplistics of it, we start to understand that, it's never going to be easy, right?
No.
But
All patients are different.
but it doesn't have to be so complicated or so complex. One of the many other amazing things about the universe uniting us three is that we also believe firmly in education.
Yeah.
I've seen both of you working with your patients, and you're very, very keen on having your patients understand, first and foremost, what is happening. Before you even talk about therapy, procedures, what is going to take place, you educate the patient on understanding why it is that you feel they have come to this place in time, and why their health is not in optimal conditions, which is what we three really believe in. As you said it, Andres, that we can firmly help people get to their fullest potential, right? They can truly have optimal health, quality of life, wellness, all of
In a
this.
comprehensive way, because you're not just treating teeth or treating your nutrition or the hormones. At the end, we're trying to give a patient a better way to live. That's it, right? Removing the factors, of course, and the best way is with education, because at the end, if you show the patient a CT scan, for example, showing the teeth that are bad, the root canals, the infections, telling the patient that the infections trigger the immune system, and of course, all this sympathetic mood and all these concepts. If you show this to the patient, they'll be able to understand why they have to remove that and go back to this guy here in order to have a little optimization of several levels, and it's a circle, right? It's a circle.
Yeah, referrals go both ways, because sometimes traditional medicine has a problem with trying to understand how the both things merge together. I mean, sometimes us dentists, we feel like the mouth is a completely isolated organ and the actual patient. So that's the first door of entrance. That's the first point of entry in the body. So it's interesting how a functional medicine doctor will understand that perhaps a patient that has a lot of mercury fillings will have chronic mercury toxicity that could be causing their brain fog, problems of sleeping, autoimmune diseases, and things like that. But nobody has told them that before.
No.
And then they come to you and you say, well, have you checked your mouth? Do you have metals in your mouth? Do you have this? Yes, I do, and this and that. But that's a missing link from traditional medicine and traditional dentistry. So that's, I think, what we're doing here. We're merging all this into the same concept as a system, and I think the results are overwhelming so far.
So far,
together, and I think that it's sky's the limit from here.
Do you feel that we can truly impact healthcare?
Absolutely. I mean, I think that one of our goals, and it's gonna be trying to make this mainstream, right? But this is the way to go. Dentistry and medicine, you know, just alternative, right?
Right. I always think that like a disruptive guys, but the idea is to move it into the mainstream.
Yeah, and you mentioned education.
Yeah.
We're also educating other doctors. So part of our plan, we have our TRYBE Academy. Okay, so we're training other dentists already to the world of biological dentistry and the world of functional medicine as well.
Yeah.
So we gotta educate the patients, but we also gotta educate the doctors, right?
Yeah.
So that's something that we truly and firmly believe in, and we're already going this way.
Yeah, because I know we've talked about this many times, and we firmly believe that one of our core missions is to educate.
Yeah.
Right? And if you really want to change healthcare, if you want to really dent the system, if you really want to cause that, I know it sounds huge, but that paradigm shift, you know, it has to start with understanding, you know, and educating and being able to truly understand, you know, and we also feel, and we do it very adamantly, very much backed by science. It's very important that, right, we're always very strict about letting our patients understand that all of this does have science.
Yeah.
You know, we're not making these things up. There is science to back up the things that we are doing. We're not making anything up, and we're being very responsible, and science is moving in that direction. So, and we didn't start it, you know, we're just part of the initial movement. But also for everyone to understand that this shift is taking place whether we like it or not, right? We just were able to understand from the very beginning that there is definitely a better way of doing things. And that's how I feel. Once again, you know, we firmly believe, us three, that our teams and us three can truly help healthcare to become something so much better than what it is today. Don't you agree?
Yes.
So what does TRYBE mean? You have two ways of looking at it, right? TRYBE was the standard word in English with an I, that it's tribe, a community of people that have like-minded people that share similar beliefs, similar goals, and also try and be. So we understand that there's not a cooking recipe for every patient, right? Not all patients are the same, and that means that not all patients will receive the exact same treatment.
Not at all.
But we're gonna try as much as we can to get you on that path and go to that finish line, which is gonna be your overall health. Our limitation as dentists is that sometimes we see our patients, we do whatever they need, we do a proper diagnostic with a CT scan, which is a great tool to understand what's really happening deep inside the mouth. But once we have finished all the dental procedures, we found out that also that was probably the end line as far as we could take it. But there were things that patient required in order to continue, in order to get to that finish line, right? But we weren't able to really get them to that. And that's where functional medicine, we believe, is so important before the treatments that we do, during the treatments that we offer, and then
as
a maintenance probably for lifetime.
You know, it's about understanding that this is not something that starts here and ends here. You know, this is a health journey through time, you know, for as long as we're...
And a very interesting fact is that the name, it includes everything. So it's a very smart name. I don't know what you think, but in my
No,
opinion,
I love it. I love
it's a
it.
great name, and
It's a great representation of what,
represents what we're doing. And
I like following up. I think that what's most important about all this is to have the patients or everybody listening to us at this moment is to understand why we came together, and I think we've been able to translate that message and to convey that message. To me, it's been so powerful to see some transformation in patients that we've seen together. Unfortunately, again, we had our limitations as dentists, and sometimes we had patients that they came in, they got their dental work, and unfortunately, because a lot of this is related to the host and not only to the materials that we're using, right? If that patient wasn't ready, that patient wasn't really, her body or her system wasn't really at the point with the supplementation and with their vitamin D and their blood levels to the point that all the treatments that we did, sometimes they failed. And that's the truth. And we didn't really understand what was that. So for us, I mean, we've seen in the last few months working together how we've had some patients that have had the opportunity to start with functional medicine, then go through the dental procedures, whatever they were, and then follow up with that. And it's been already 6 months or 8 months that we've been working together through this path. And I think that the transformation has been overwhelming. I think it's a win-win, not only for us, because it makes our treatments that we offer way more successful than they were before.
I remember one patient, she came at, I remember it was like 3 years ago. She came from Houston, and she came with a very, bad progression of a Lyme disease. She got autoimmune disease for a while. She ends up in a wheelchair with, she cannot even stand up. She was normal, a very young lady around her 30s, 35, and she came in a wheelchair. She cannot even talk. She was completely fatigued all the time. And as her part of her history is that she received a jaw surgery 10 years ago. Part of the problem is that part of the jaw surgery was related with metal screws and plates that she has in her face. So she came, we removed all the metal, we removed all the cavitation she had. And about 2 months after, of course, she was treated with a functional doctor in Utah, I remember. And we did it together. And at the end, she ends up like, riding horses and working out like a normal person. And I realized that what we do, if it's very well directed by functional medicine, it can cure diseases. We can see it every day. But yeah, part of the process depends on the functional medicine, because at the end, sometimes you can remove the metal, but if the regulation of the hormones, of the vitamins, of the
immune system,
immune system is not adequate,
the gut health,
then
so many
everything's going to
variables.
be a mess.
And I see it from the other perspective as well. Like I said at the beginning, how many times have you been able to improve on your patient's health journey, and then you feel like you're getting stuck?
Yeah.
You're like, there's.
We discussed about a
Yeah,
patient
yeah.
like
We
5
just-
years ago,
yeah, we-
5 minutes ago.
Yeah, we discussed, and a patient of mine who, in paper is super healthy.
The numbers.
Chook. All biomarkers are healthy, and you see her, and she's a very healthy person, but she wasn't feeling 100%, and so I now start learning to ask the oral health questions, where we find out that she has had past conditions regarding her dentistry. You check her, you do a full scan examination, and you explain to both of us in detail, this is happening, and this is happening, and this is happening.
Several infections.
Chronic conditions that is not clear to the human eye, and so everyone misses it. Even myself, even the functional medicine,
Even she went like to 4 or 5 doctors, dentists.
4 or 5 dentists who,
And at the end, nobody talk about root canals, infections, and it was very clear. And that's the missing link in that patient. She's going to be 100% once we remove all the factors. And it's not like, rocket science.
No, and I think there's a really big problem in healthcare and that is everyone is doing their own thing.
Yeah.
You know, there's such a lack of collaboration.
Yes,
You know, right, Alejandro?
absolutely.
We all talk about this. I mean, I know I'm truly excited because we're always communicating and we're learning from each other, and we're like, hey, how do you do this? Do you think this could be affecting? No. Do you? Oh, that, my, for sure. I've seen that 100 times. I can tell you right now that that tooth that is not white has to be causing some of her conditions, and this you would never be able to do on your own, right? Or it's really hard as a doctor to also be in close communication with dentists.
Sure.
I'm not calling dentists all, hey, friend, you know, do you think this is happening? This is not something that you guys in dentistry and we in medicine were taught to do, to communicate. And so there are so many things that are not being done and not being done right just because of a lack of communication. And I think that's an amazing thing we have here.
In general, in medicine, we never talk about nutrition. We never talk about sleep, but we never talk about basic things. Yeah. And that's part of the collaboration. It's stress management.
Lifestyle intervention.
Unfortunately, in our profession, biological dentistry is less than 3% probably of dentists in the world. Functional medicine is probably lower numbers than that. I think that our goal as TRYBE is to try to get this idea as mainstream as possible, try to bring hopefully a TRYBE to every corner in the world, right?
Yeah.
But basically it's the integration of different areas of knowledge, as you said before. Instead of a patient trying to go to 7 different places and try to get a single cause for their disease and a single treatment to where they want to get.
Right.
Understand that they can go to a simple place, a place that will understand them, where everything is gonna be treated and researched and try to get to the root cause of their problem.
Investigated properly.
Try to get to a simple treatment, but not only patients who are sick, also patients who don't want to become sick.
Exactly.
Patients who want to optimize the way that they heal. Prevention. Patients that wanna not live forever, but they want a very good quality of life for as many years as we can get in this world, right? So I think that our goal is to try to get this message through, educate as many patients and hopefully doctors in the process, try to get this word out as much as we can, try to get a TRYBE set in different areas in the world that we're already in conversations about different areas that we want to get started with.
Yep.
And train as many people as we can. Keep on training ourselves as well into getting better and there's so many things that we still need to learn. As you said before, we learn from our patients all the time as well.
All the time.
But we learn from each other. That's our goal, I think, ultimately. Getting the word out, educating, and trying to help as many people as we can in the process, right? So that's true.
I mean, 100%, because to not get into boring details and statistics, we all know that the current healthcare system is broken, obsolete. It is collapsing. It's not really doing the job to keep our societies truly healthy. And it's not promoting health.
No.
It's not promoting oral health. It's not promoting overall health.
It's reactive, not
It's not
proactive.
Yeah, it's not promoting lifestyle intervention. It's just waiting for people to get sick, and then you come see the dentist, and then you come see the doctor. So I think and I'm so glad that we three are very much aligned, and we truly believe in the power of education, is because if this is going to, one, create a major shift, like you say, and two, make it long lasting, like Andres is saying, I mean, the only way is for us to truly educate people in prevention,
Sure.
into understanding that we have to change the way we see healthcare and be more proactive about the way we approach our health, and in an integrative fashion, not just, okay, I'll do better here and I'll do better here. It's just like, let's pay attention to the whole integration of your health.
Your daily basis, everything, your sport, your life quality, the quality of life, your sleep, your dental health,
Relationship.
mental health, your relationship, your nutrition. How many hours in medical school do you spend talking about nutrition or sleep or mental health, or knowing dental health. Nothing.
Dental? Nah,
Zero.
nothing, zero.
Yes.
Dental health, like one class of nutrition,
Yeah.
nothing on sleep, because way back then,
Zero.
sleep is super new. And
Stress management.
you know, stress. And I did.
How many of your teachers, they do sports, they have good relations, they eat well, so that's not important on medical school and dental school.
Yeah, so I think that overall it was important for us to do this video because we received a lot of questions. What exactly is TRYBE? What are you guys doing together? What are dentists and a functional medicine doing within the same building? So we thought it was important to hopefully try to get the message out of what we're doing. I hope you guys liked it. I know there's gonna be many questions, but we're here. We're here for you, and yeah. So visit us at alltrybe.com, and there's many areas there where you can interact with us, and we hope to see you in the near future.
Real pleasure.